It's Kris and Caroline Stanbury's Not So Epic podcast.
Brought to you by NMC Healthcare and Cosmesurge. Head to cosmesurge.com.
So here we are, we're back. It's Kris and Caroline's Not So Epic podcast, but if you could see it right now, some of you may be watching it, some of you are only hearing this podcast. It is so epic to see how Caroline Stanbury looks right now. Hello, Caroline.
Hello, Kris. This is exactly where I wanted to be. Covered in numbing cream, sat here in a surgical, what is it called, hat with you.
Yeah, this is great. You know what? First of all, I want to give you props because not many people would want to share this experience, and the fact that we're doing a podcast that we say is not so epic. It is epic today, people. It is epic, I tell you. And we've had some big stars on our show already, but this is epic. Now, the reason why you're covered in numbing cream across
It hurts, Kris.
What are we doing? What are we doing today?
Well, you know, I like to come prepared. So basically, Dr. Kassabian is one of my very good friends too.
Yep.
And he's the only person I let near this face, except maybe my husband. And I have slathered myself in numbing cream just in case he decides to go off track. Because sometimes he does.
Okay.
And I'm like 43 now, and I'll take all the help I can get.
All right, so now we're here at Cosmesurge here in Dubai, Conrad Hotel, level 18. It is beautiful. I'm painting the picture of the view right now. Let's pan. Let me just see this view.
All I can see is giant needles, Kris. Giant needles.
Burj Al Arab up there. You got the Dubai Marina view. It's gorgeous day here in Dubai. And let's welcome to the podcast that's so epic right now, Dr. Kassabian. Thank you so much for joining us.
Hi, Kris. Hi, Caroline.
Hi.
So listen, what are we? Obviously, you are based in Beverly Hills in LA,
Correct.
but you travel the world because people want to get your hands on them, basically, right?
Correct.
How important is it? Because I asked this question to Caroline, and I was not sure. How important? It's obviously important for people to find a good person that they trust. And Caroline, you said something to me a couple of weeks ago, which was like, it's your face. You can't let anyone touch your face.
No, because I get a lot of women here and all over the world going, well, you know, not all over the world, but friends of mine from all over who say, well, he's expensive.
Yeah.
And, you know, compared to some people he is, and compared to others he's not. But my view is you can have street art or you can have Picasso. It's my face. You're going to buy a Birkin. I'd rather not have a Birkin and have my face remain looking beautiful than have a screwed up face, which has happened a lot to many, many women, unfortunately, and he gets to fix a lot of them. So, you know, for me, I'd rather see the best straight away, and that's what I've been doing, and I've been seeing him for many years now.
Dr. Kassabian, how did you get into this?
Well, I'm a board-certified plastic surgeon, but I love doing these injectables because I'm using the techniques I use in the operating room and deliver it to the patient. And the best plastic surgery or cosmetic surgery is the one you can't tell anything's been done.
Yeah.
So I'm using those techniques to lift what needs to be lifted, whatever is hollow, whatever needs to be adjusted. But at the end, the patient looks beautiful, like a nice jawline, nice heart-shaped face. That's what we're looking for, without exaggeration. Like
Better version of ourselves.
right. And the techniques, like I said, that I'm bringing from the operating room include like not using a needle. I'm using a cannula, which is a soft tube. That minimizes the chance of bruising, swelling, and all other serious side effects, and also gives them a more natural look.
Okay.
And it holds off having to have a facelift. To what age does women normally do facelifts now?
It's whatever your genetic type is, and also the stressors in
What
your
age
life.
are you going to do mine? Put it that way.
That's right. Well, let me say, Caroline doesn't need anything. She's beautiful. She's gorgeous. All she needs is to be cloned. So can you imagine?
Oh my gosh. If there was another Caroline, I'd be out. I've left the room.
But because it's her birthday tomorrow, happy birthday, Caroline.
Thank you.
So we're just going to make her happy. There's a few things that bug her, and I'm going to take care of those.
There are little things that happen when you get to my age. Like, you know, the sides of your mouth begin to go down. You always look a little bit unhappy.
But doctor, can I just say, like, there'd be so many women and men that would come. Is it more women than men? Is it even now? Like, what is the percentage?
It's 70-30.
70%
Right,
women,
70%
men.
right.
Are you seeing more men come to do it now?
A lot of people aren't as sane as you, Kris.
Yeah, I know, right?
And you'd be surprised when we come to the UAE or in the Gulf region, like the men usually go before
The
their
women.
mates, before their wives
Sure.
to do it.
They make the
Where-
appointments and then they come
Yeah,
in first.
in like LA and other places I've been, it's like ladies first, but here,
The men are like, we are going first. We are the man. All right, and then the other thing is that I wanted to talk about when it comes to sort of plastic surgery, but fillers and Botox. Do you know how to tell someone that they've had enough? If a woman or a man comes in
Oh my
and
God, he always does.
Yeah,
absolutely.
Is it your role to
turn
reject?
about 30% away, or I say let's wait 6 months, a year. This is not an emergency.
Yeah.
So and sometimes like they come in asking for a nose job, and it's not really their nose; it's their under eye, or it's their chin is weak. So you need to bring attention to that.
Okay,
And
yeah.
also we have the tools to do that. We can take a photo and morph it, and
You can do a nose
yeah,
job without doing a nose job, with just fillers. It's
with just fillers. Yes.
Hold on a second.
Yeah, there's no hope for you.
So could this be lifted at all ever?
Yes.
Chris, I'm good, but I'm not a magician.
Not on this Lebanese nose I've got. All right,
No,
well,
what we can do is like a drop of Botox here on the bottom. What
my
that does
God.
is weaken this muscle that pulls it down.
wow.
We can
there.
add a tiny bit of
There,
filler in the
there,
top,
the top would
to
straighten
simulate it. Yeah.
I've never thought about that. I thought always, so if I ever, no, listen, I'm happy with my strong Lebanese nose, but at the same time, it's getting bigger, man. Every year, I swear, I feel like at one stage, someone's going to take a photo of me. It's just going to be a nose with a little bit of eyes at the top of it. It just
You
doesn't
met
stop.
my husband?
Jim's got one as well.
Yeah, he's got one. When I met Jem, I had to work out whether we were going to go left or right to kiss him.
Because of the nose. You know what they say, though. We're going to go back into it. We're going to get back into this right now. So here we are, Kris and Caroline, a not so epic podcast here with Dr. Kassabian down here with Cosmosurge,
Lovely.
Dubai. You've been numbed. I'm going to obviously stay a little bit away here. What are we doing first up with Caroline? What are you going to do?
We're just going to do a little bit of cheek contouring and then come down the corner of the mouth, the marionette lines, those I'm going to lift them up.
Mm-hmm.
So
A
look
few
happy,
drops
not
of
sad.
Botox in the upper lip, that's to do a lip flip.
Lip flip.
And a tiny bit on the chin to give a little bit of more chin
Okay.
projection.
There we go.
That's it.
Can you do anything for her personality? No. Okay. Here we are. I'm going to leave it here. We're going to keep this rolling. Welcome to our podcast right now. We've got a bunch of nurses in the background here and the medical staff, the assistants all helping out.
My green tea.
Your green tea is there,
Look
Caroline.
at the size of these needles,
There we
Chris.
go. Oh my gosh.
Look at the size of these. It looks scary.
So
when
epic.
it is.
It's so epic, this podcast. All right, so having a look here. I'm just behind you. You guys go ahead. We'll stay clear. I'm just going to make sure that I stay clear. The last
As long
thing.
as we get our podcast, don't worry if the numbing cream set in yet.
Yeah, we've got a time here. Let's go. No, I don't want. So basically, Caroline, do you remember the first time that you ever did any type of Botox or fillers? Do you remember how old you were?
Yeah, I was a lot younger. I was mid-20s, I think I did
Okay.
Botox when it first came out.
Yeah.
I've done Botox my whole life, and I think it's great. It's preventative. If you start young, it prevents you having wrinkles, doesn't it?
That's right, yes.
Because you don't use those muscles.
When wrinkles start happening, it starts thinning out the skin between the muscle and the fat. And the sooner you do it, that's where the preventive part comes. So, especially here, and the
I
forehead.
never did fillers till I was much older.
Okay.
Yeah.
Right, I did fillers, I think I started when I was in my 30s.
Go ahead. All right. So
So
first.
like in general, Botox, we do it around the eyes for the crow's feet,
Yeah.
and then the forehead for
So
the
for-
horizontal lines, and for the frown, those vertical lines, the 11s. And also in the neck, it would be nice for this
Those
muscle, when it clenches for me. You see these,
Yeah.
when you relax these bands, the skin drapes nicer. And also this jowling springs out. So that's the beauty
Wow.
of doing it.
I don't have all that though.
Not yet. Not yet, Caroline. All right, well, some of you may be into this sort of stuff. Some of you are probably going, gosh, why do people do this? I guess it's each to their own. I get a lot of people tell me, doctor, I don't need it. I don't need Botox yet. I don't need Botox yet. But from what I understand, again, just hanging out with people that have been doing it for a while, it's not when you need it. You want to do it before you need it because that will prevent you from getting those creases.
Correct.
Is that right?
It depends. It's each to their own. Some people, like my mum, never did anything like this.
Yeah.
Anything. She's like horrified by me.
It's the French system, yeah. You can.
Yeah.
Alright.
So like
All
nothing.
natural.
All right, Caroline,
Yeah.
now you may have to stop talking here.
I know.
All right, so you may not hear Caroline's voice here on the podcast for a moment.
I don't think they do
We're-
anyway.
we're-
Chris.
No, they do. They do. Okay, so I'm going to do a play-by-play of what's going on here. Doctor, feel free to guide me with your voice as well, because I've really got no idea. So what Doctor's doing right now is he's wiping off the fake tan. That's what he's doing right now.
No, that's my Huda. That's my new Huda. I just tried it. Not my mama's pantyhose.
Hold on, I think we've got it here. Is this it here?
Yeah, but no. Yes, but no. Yes,
That's just the. Here we
It
go.
might be in there. No,
There we go. No, you relax. Here we go. If you can see that, the Huda Beauty bag. We just wanted to get that promo in there. Hopefully Huda and Mona and Alia will sponsor the show and we'll get money out of you girls. Hi ladies. No, I'm joking.
No, I tried her new like shimmer for the face, which she's just wiped off my face. So I should know better. Normally I don't wear anything. I don't know why I even tried it.
So doctor, first step here is you're marking it with
I'm marking her cheek injection area.
By the way, a lot of times, this is a big thing, in people inject the front of their cheeks,
Yeah, and that's,
and he doesn't do that.
okay.
And that changed a lot for me, because that's when you get that sort of chipmunk look.
Yes.
Where
See that?
like
So
people
many
like look
ladies
like
have
this.
that.
Yes, like Chris
Yeah.
has got right here.
Yeah.
Yeah.
Hey, don't do it. These are all natural.
Yeah, like
these
we're
babies.
storing nuts for later.
Yeah.
Yes,
Right,
this is not what he does. He goes all the way from the top and down, and also like sometimes he'll do one there.
Yeah. We're doing like a tiny bit here, but more the
Up
focus
there.
is on the lateral cheek to give her the
Hollow.
cheek contour
You know when
highlight.
you suck your cheeks in,
Yeah.
and then he
That's
brings
right.
this out.
So now we're also the corner of the mouth, the marionette line. I'm gonna lift that up.
So I'll
with
look
the
happy.
filler, I'm gonna come this way and lift it up. And this, and let me see your teeth.
So
And then-
currently doctor's just marking out Caroline's face now with a white
Just gonna go
pencil.
midline here and add a drop here to give her a little bit more.
If you're not watching this, you can watch it on our YouTube page, which is Kris and Caroline's podcast. This is what the Kardashians do, is it?
You know, like they bring this whole thing out. That's
Yep.
like what changed those girls' faces
Okay.
completely. Bring the norm, you know, like
Yeah, the Kardashians did change. I mean,
Oh
you
my
see those
God.
early photos, it's like, wow.
totally different. And it was from like bringing, I mean, he does it much more severe than the doctor does it, but they brought like their chins straight out, and it's sort of in a photograph, it makes them look really, really,
Nice.
yeah.
All right. So the gloves are going on now, doctor. I think this is business. How long will this all take, roughly, this
A
procedure?
few minutes. So first I'm
Few
gonna
minutes.
He's
do
so
a few
fast.
drops of numbing,
Okay.
and then we'll go from there.
Do you want to hold my hand?
You need it.
Numbing, right? Yeah. Okay.
The numbing's the
So
worst
this
part, to
is,
be
So
honest.
here we
this
go.
is lidocaine, just a.
So this is
drop
actually the
here.
numbing agent. She's taken a deep breath in. She has had 3 kids, so I think this is okay. Well done, Caroline. You're doing very well under the camera. The needle has gone in again. A little bit of a flinch from Caroline, but she's doing just fine. No laughing.
It's just so annoying.
No, relax. There it is, another little prick.
So this way.
What got me in this mess in the first place?
Okay, Dr. Kassabian here once again, Cosmosurge. And get it in there again. That one hurt a little bit. Now this is just the numbing stuff, which is going to, I'm guessing, not make it so painful when you're doing the other injectables. Yeah, you're
Exactly.
getting that into that cheek. Oh, I'm feeling it here. I'm feeling it here.
Just move one side.
Now remember, if you're into this, make sure you find the right person to do it. It's your face. And as we've seen in previous episodes when we caught up with Rodrigo Alves, who is the man who's had the most plastic surgery in the world. You know Rodrigo? Have you ever
Not
seen?
personally.
So we had him on our podcast, and he,
Yes.
you know, I think he said that he made a lot of mistakes by going to the wrong people.
And they
so
kept saying, do it.
they kept saying do it, and he said most of his surgeries have actually been corrective surgeries.
Yeah.
So he got his nose done and had to get it done 11 times more because they kept making mistakes.
You can't breathe, bless him. Are we starting?
Okay.
I'm just gonna make the openings
Fine, here we
now
go.
where the cannula is gonna slide through.
Okay, so now we are, I don't know. I don't want to make her laugh, so I'm trying not to talk too much. I'm going to go back here in the back and just not get so close. We'll go over here to Dr. Kassabian.
You don't have to be quiet. This will be the worst podcast ever.
No, this is good. Now remember, you can watch this if you're only listening to the podcast. Just go to YouTube, you'll see this entire procedure. Kris and Caroline's Not So Epic podcast.
Here.
If you think so, do it.
Okay.
That one got to hurt right on the chin.
That doesn't hurt.
No?
No.
Well, she's been numbed.
So now she's not feeling it.
Yeah.
How long does the numbing agent last for?
Like an hour, but it's such a tiny amount that it's not an issue.
Okay, we're starting now.
One second, just numbing you a tiny bit more. Okay, and then this area.
The little bit of pain there. What do they say? What's that saying? No pain, no game, right, Caroline? All right. We're just
See how
here.
small those incisions are?
Yeah, it's tiny.
Sit down.
I feel like I'm gonna faint. I don't know, I'm pretending that I'm all okay, but I'm watching. Yeah.
Chris needs a bed.
I may drop if I drop at any stage. I'll be all right.
Oh God.
Oh, here we go. Oh, look at the size of that.
No, this is a cannula. It's a soft tube. You see, it's not sharp.
Okay.
So I
I'm just
made
gonna
a
close
tiny
my eyes.
opening in the skin so that this cannula can slide in. So the cannula will go in. And that way it's not traumatic, it doesn't bruise, it doesn't swell. So you
It's
see
very
I'm
deep.
in.
Yeah, it goes all the way in. Wow. And so what is that you're putting in right now, doctor?
Filler.
This is a filler.
Sounds like you're doing a voiceover for porn.
Oh my God. Well, if this doesn't work out, you may have to.
What are you putting in? I didn't even think that. All right, so that's
Next,
now.
Ron Jeremy.
God.
No.
Oh, no.
Here we go again.
So you see, it's a blunt, because it's blunt. It just slides in. And my focus is the lateral cheek rather than. See, the mistake is people, they take the syringe and empty the whole thing here in the apple of the cheek,
And
then-
that's what gives that
That
impression
look,
of like
yes.
cat being a cat woman.
That doesn't make you look more youthful. It just looks like you have filler.
And they all begin to look the same. The trouble with LA, a lot of these women look the same.
Yep. And then how long does a filler last for?
This product lasts a year to 2 years. It's called Voluma. It's by Allergan.
Okay.
What's good, what I like about it is it's got lifting properties. So you want it to lift the cheek.
Okay. All right. Well, there's a number of insertions going on right now into the face. And then once it's in there, obviously, is there anything that you shouldn't do for the next 24 to 48 hours, or is it okay?
Probably I would avoid working out
Okay, well that's
the
Caroline.
same day.
Okay.
And then, in case of Botox, you don't want to lie down right away.
Okay.
Like wait like 4 hours for things to settle. So.
And then I see once you put it in, you're pressing it. What are you pressing it for? Is that just to mold it?
Just, yeah, shaping it.
Okay.
Because this is a gel.
That doesn't
And so
hurt
what
at all.
does the gel turns into a different type of form later on?
No,
It goes from
but
gel.
you,
No.
you got this kind of gel, you've got a few days to mold it into shape.
Oh wow. Okay.
And so that's why it's important, like you don't sleep on your face.
Sure, because then it will mold that
Especially,
way.
like, yeah, especially people try to avoid like getting massages where, you know, that opening.
Oh wow, you could have a massage face permanently.
Right.
Oh my. All right, here we go again. So how are you feeling, Caroline? Is there any pain or?
There's no pain. It's just very.
It's all gain. It's all gain.
It's all weird. I just don't like to look because I think
Yep.
if you see the needle,
Yeah, totally.
I just prefer to keep my eyes closed. Oh, that was a
Sorry.
bit pain.
Wow, look where that is deep. I mean, as in,
Chris,
no, like I'm saying, like I can see where it comes.
so glad that you are here.
Wow, that is amazing. I remember if you don't hear from me for a while, it just means that I have fainted.
Change profession.
I've fainted. I have changed. Yeah, I've never had to do this in my career. Watch this happen. This is pretty interesting to watch. It is totally a work of art, Doctor. It is not. This is something
See how
that.
fast he does it?
Yeah, but it isn't. It is an art form. It is putting it somewhere and making sure that it sits the right way. So it's fantastic. Well
How do
done.
I look right now?
Yeah, you don't look good right now. Let's see how.
So these are like what I'm doing is the smile lines here. They're called the parentheses. And next I'm gonna be doing this is even a smaller candid line. You see, again, it's soft.
Still not
I'm
watching.
gonna do the corner of the mouth. This is a little bit sensitive, but this is what I'm reaching here to lift this corner up. Okay, and then we're gonna put a drop in her chin to give her a little bit more chin projection. That's more youthful and, I mean, it's a feminine look.
I can see it growing. No, really, I could just see it go in then.
There we are. I just need to do
Oh,
the
that
other
is
side.
it.
And we're-
Okay.
Yeah. And the next is with the Botox. And
Okay, so that was all fillers right there. All right, so now we're back with some Botox, it looks like. Is that under the
I
neck
just
area?
got done doing the Botox in the neck area. So you see to soften these muscles here, when you soften this, the skin drapes nicer. And I'm gonna put a little bit on this side, along the jawline. And this will help spring the tissues up. Okay, next we'll go to the crow's feet. Smile, relax. Okay, turn towards me. Very good. Raise an eyebrow, relax. Doing some on the forehead for the horizontal lines. And these are, I'm using a needle, but these are the tiniest needles probably they
Yeah.
make, tiny Japanese needles.
Okay.
They're 33 gauge, it's pretty small.
You feeling that at all, Caroline?
Nope. The Botox doesn't bother me. Actually, under the neck and under the chin is the most genius part. I'll probably feel the lip.
Oh, you're doing the lip.
No, he just puts Botox on the very top. I'm not definitely not making my lips bigger, people.
Yeah.
Sorry. A little bit sensitive here. Your eyes, this is the lips. We'll use a little bit of ice, and that will help.
This is not filler.
Yeah, this is to flip the lip. Okay. Put pressure there. Sorry. And we're done.
Oh, traumatized.
The whole thing took about 15 minutes from start to finish. How do you look? Caroline was trying to, because we're filming this as well, obviously, but she brushed herself up, and I said to her, Caroline,
There's no point. I've given up. It's just me.
So what advice do you give to women who are thinking, who have never done any type of Botox, fillers? What's your advice?
I really think it's a good alternative to surgery. I think it's an amazing thing. I think you can take, you can feel great about yourself,
Yep.
and it's a quick fix, and why wouldn't you? You buy handbags and shoes to look good. This is your actual body.
Amazing. Dr. Kassabian, renowned of being one of the best in the world. Thank you so much for spending some time with us. If you're in Dubai, obviously Cosmosurge down here at the Conrad Hotel. But obviously if you're in the States, in Beverly Hills, we come see you there.
Yes,
where
of course.
Where do we go?
I'm at 436 North Bedford Drive, Suite 301.
And we'll go. We'll put all the tags.
Or find me on Instagram at Dr. Kassabian.
We'll put all the tags. We'll do all the tagging. Hey, it was a pretty epic podcast. I'm happy with how it went. Right?
Well, I am. I mean, look at my face. Once I've got makeup on again, I'll look great, guys.
You look great right now. There it is, Kris Fade, Caroline Stanbury, and Dr. Kassabian with our not so
happy
epic
birthday,
podcast.
Caroline.
Yay!
Thank you.
It's Kris Fade and Caroline Stanbury's Not So Epic podcast.
Brought to you by NMC Healthcare and Cosmesurge. Head to cosmesurge.com.